Hello friends, let me continue with the ligaments of the shoulder joint before we go to next. Right now we have completed the capsular ligament. I would like to give you a brief again. This capsular ligament is a thin fibrous band, and medially it is attached to the margin of glenoid labrum, and laterally it is attached to the anatomical neck of humerus, and below medially it is attached to the margins of glenoid labrum. It goes downwards, and laterally it is attached to 1.5 centimeters below the surgical neck of humerus. Right? Now, inside the joint capsule, so to say, the inner surface of this joint capsule, it is lined by synovial membrane. So this synovial membrane basically it reflects from the glenoid cavity to the articular head of humerus. It is the total here. Let me show you. I have other diagram for this. So this is the humerus, this is the clavicle, this is the scapula. I haven't drawn this synovial ligament yet. So let me take violet. Yes. So here the synovial membrane, basically it starts from here. There is glenoid cavity. I forgot to draw that. Yeah. So this is the glenoid cavity. So from glenoid cavity or glenoid labrum, it reflects onto the humerus, right? Has the articular margin of the head of the humerus, right? And this is the articular margin of head of the humerus. It has reflected till here. This is the first one which you have to remember. And this synovial cavity has nearly two features. The first one is, let me first draw the anatomical things which you see here before we go here, because I didn't fill the ligaments completely here. So yeah, so here this is a bicipital groove. So joining the greater tubercle and lesser tubercle, there is a ligament which is called as transverse humeral ligament. What is this called? Transverse humeral ligament, right? Humeral ligament. So starting from lesser tubercle to greater tubercle, there is a ligament which is called as transverse humeral ligament. And from this bicipital groove, if you see, the tendon of biceps forms. It starts like this, but why I didn't draw this, you will know. So what is this? So this is tendon of biceps, right? And now joining the coracoid and acromion process, you see a ligament which is in V shaped, and this is called a coracoacromion ligament, right? So this is coracoacromion ligament, right? And there are two bursa. One is infraspinatus bursa and the other is subscapular bursa. So here there is subscapular bursa, and you can see the suprascapular bursa here, right? In this here you can see the suprascapular bursa, so just leave it on. So in this view you can see, right? So coming to the synovial membrane, all these are the surrounding structures because I have completed the diagram. So one which I have said, first point is it joins from the glenoid labrum to the head of the humerus. That is first. And along with it, it forms two main features. The one thing is it forms a sheath around the biceps brachii. So here I said biceps brachii is like this. So it forms a sheath around it such that in this view you can see the biceps brachii, right? That is the reason why I didn't draw. So if it's like this, so it covers entirely like this, right? So you can see the tendon of biceps. So it covers it ensheathes the tendon of biceps. That is the first thing which you have to remember. And the second one is it communicates with this infraspinatus and suprascapular bursa, right? So it communicates with this. So this is the synovial membrane. So as I have said right now, you have nearly two important features of synovial membrane. So one is it starts from glenoid labrum to articular head of humerus, right? And the second one is it forms a tubular sheath. You can see here tubular sheath around biceps tendon. This is like this, it forms a tubular sheath like that, so that in this view you can't see the tendon here, but you can see this is what I drew here, right? This is my green color and this is violet color, so right? Now, and the third one is it communicates with subscapular and infraspinatus bursa. Right? And due to this synovial membrane, you can see three apertures in the joint capsule. Right? You can see three apertures. What are these three apertures? Three apertures in joint capsule. So what is the first aperture? There is an opening, aperture is opening, right? There is an opening between the two tubercles of humerus for the passage of tendon of biceps. This is first one. First, for passage of tendon of biceps between two tubercles. And the second one is there is an opening which is situated this is the coracoid process, right? You can see coracoid process here. Fine. Yeah, this is the coracoid process, you can see here, right? So you can see the coracoid process here. So there is an opening which is situated just below the coracoid process here for communicating this synovial membrane to the subscapular bursa. This is the second opening, right? Below coracoid process, for communication between synovial cavity and subscapular bursa, right? And what is the third opening? Simple. So there is a communication between synovial and subscapular bursa. There is an opening, and there is other opening for communication between synovial cavity, and you can guess there is other bursa here which communicates, and infraspinatus bursa. I am just writing it so that you will even know, writing in exams or remembering things. So right, so this is about synovial membrane. So in the synovial membrane, you can see it starts from the glenoid labrum here and then to the articular capsule, but it forms a fibrous sheath around the tendon of biceps 1, and it communicates with subscapular and infraspinatus bursa. So there are 3 apertures. What are they? One is for the tendon of biceps and the other is for subscapular bursa, communication with the synovial cavity, and the third one is for infraspinatus bursa, right? So this is about joint capsule. So the second ligament which we will discuss here is about glenohumeral ligaments, right? Glenohumeral ligaments. I may be a little slow here, but I wanted to be slow to make you understand in a clear way. So here in glenohumeral ligaments there are 3 thickenings, right? In the anterior part there are 3 thickenings. One is superior, middle, inferior. All of these, as the name says, they start from glenoid process to the humerus, right? So let me draw them. So there are basically 3 thickenings, right? So one is superior, right? This is the head of humerus, and from the head of humerus it starts upwards and then it joins the superior part of glenoid cavity, right? So this is the first one. And what is this called? Superior part, right? And the inferior part, middle part, it starts from here, from the same place as the superior one, that is in the shoulder joint, and then it encapsulated in the middle part of the glenoid labrum. So right, this is the middle part of glenohumeral ligament. And the third one is, which is inferior. This basically starts from the glenoid process and then it is inserted into the joint capsule. So right, so this is basically the joint capsule which I would like to draw here. It is a little below, right? It doesn't insert exactly into the surgical neck. So this is the joint capsule. It became really big. It shouldn't be this big, I know, right? So let me change it to different color so that, yeah, it's here. So right, so this part is the inferior part. Right, this is about glenohumeral ligament. So in the glenohumeral ligament, anterior part, it has 3 thickenings, you see. So it basically has 3 thickenings, which are superior, middle and inferior parts. And if you see, you can see only the inferior, you can see all these from the below of the joint. You can't see from the above, you can see you can see them only from the below the joint. And if the defect appears between the superior and middle glenoid ligament, glenohumeral ligament, then there may be anterior dislocation of the shoulder joint. Defect in superior and middle part results in anterior dislocation. Right, this is about glenohumeral ligaments. Now coming to the other 2 ligaments which you will learn here. So the first one is, the third one is Coracohumeral ligament. As the name says, it starts from the coracoid process that too from the base of the coracoid process. So this is the base, this is the coracoid process, and from the base of the coracoid process it goes upwards and then it is inserted into the anterior aspect of greater tubercle. So this is greater tubercle, right? It is inserted into the anterior aspect of greater tubercle. So this is coracohumeral ligament. So where does it pass and where does it get inserted? This starts from base of coracoid ligament and then extends and joins at anterior aspect of greater tubercle, right? So this is the coracohumeral ligament. So now let us complete it with the last ligament, which is transverse humeral ligament, right? So this is the fourth ligament, which is transverse humeral ligament. Transverse humeral ligament, which joins the greater and lesser tubercles, right? So this is the greater tubercle, this is lesser tubercle. Greater and lesser tubercle. So it joins greater and lesser tubercles, right? So this joins greater and lesser tubercles, and it also provides a space for passage of tendon of biceps. So this is for the passage of tendon of biceps, right? So this is about transverse humeral ligament. So finally you have two accessory ligaments. We have already explained you. One is coracohumeral ligament, coracoacromial ligament, and second is coracoacromial arch, which I have already explained it while we are dealing with in the capsular ligament, right? So I don't want to repeat it again. So finally, coming to relations, and you have to deal with bursa. Fine, I'll complete relations first and then I'll come to bursa, right? Because relations are a bit more. So, because even in the relations itself you can complete the bursa clearly through this diagram. So right, so this is the glenoid cavity, right? Over the glenoid cavity, if you see, there is a synovial cavity. So this is the synovial cavity, right? I will fill this diagram, which is relations, right? This is the synovial cavity, and to the synovial cavity, if you see, there is the attachment of long head of biceps, right, which passes through the arch, all that thing, right? This is biceps. So what did you do right till now? So this is synovial cavity which surrounds everything, and this is biceps tendon. Right? So now, all this is glenoid cavity. All this is surrounded by subscapular bursa. How does this bursa look like? Let me draw. You're able to see this, right? Yeah. So this bursa basically just follow the diagram which is given in your book, because I'm just drawing a rough diagram. If this is not so neat, then follow the diagram from your book. Okay, this is subscapular bursa. What is this? Subscapular bursa. I'm going from inside to outside, right? All this glenoid cavity is surrounded by subscapular bursa, right? Around this subscapular bursa, you can see the ligament. You know what is that ligament? It is simple. It is joint capsule. So this comes the joint capsule surrounding it, right? So there is joint capsule surrounding it, right? Now you can see some muscles, like starting from let me get it here. First, supraspinatus muscles in the anterior aspect, right? So this is right, which I'm drawing a little bigger. So this is, so let me write it in black ink. This black pen. Black, I love you. Supraspinatus, right? And medially you can see subscapularis. I will even do a class with bones so that you will understand, but not now, after I complete everything. So this is subscapularis, right? And then these are anterior, this is posterior, this is superiorly, and this is inferiorly, right? Subscapularis you can see, and after subscapularis you can see, so let me draw the subscapularis a little bigger. A muscle above subscapularis which is very important, which is pectoralis major, right, which is an anterior relation. And now coming to the bursa, to see, here there is an acromion process, and here you see coracoid process, right? So this is acromion process and this is coracoid process. As I have already said you, joining acromion and coracoid process, there is a ligament which is coracoacromion ligament. The coracoacromion ligament, coracoid process and acromion process commonly form coracoacromial arch. That's what I have already said you, right? So this is coracoacromial ligament. And from the coracoid process, you can see two muscles which arise. One is coracobrachialis, this is a muscle, ligament of a muscle, and the second one is short head of biceps, right? So this is coraco. The main thing is this extends till here. This will be an anterior relation, right? Coracobrachialis and short head of biceps, right? And between the acromion and the supraspinatus, you can see a muscle, you can see a bursa, which is called as subacromion bursa, right? So this is subacromial bursa. It is below the acromion process, so it is subacromial bursa, right? And what about the other muscles? Now, arising from the acromial process, there is a muscle which is called as deltoid, which is the biggest muscle, which is the biggest shoulder muscle. So this is deltoid muscle. Right? And now, this deltoid muscle is present around the acromion process. So even it is present here. So this is deltoid muscle again. Right? And now, below the deltoid muscle, you can see under two different muscles, which are infraspinatus and teres major. Infraspinatus and here teres major, right? Fine. And below it there is a muscle which is long head of triceps. I think you all understood how it related. If not, just give me a minute, I'll again explain you in detail, or give me a comment. And coming to here, below it there is teres major muscle. Right? And below the teres major, basically you can see a nerve and an artery. Just below the joint capsule, I have already drawn it. If you remember, I think most of you guessed the correct. It is posterior circumflex humeral artery, which is this one. So this is posterior circumflex humeral artery, and a nerve which is axillary nerve. This is and below this there is an axillary artery and axillary vein, right? So this is axillary vein and this is axillary artery. So if you just remember this figure, you can clearly say the anterior relations, posterior relations of the brachial artery. So what are the anterior relations? First, superior relations. Starting with superior relations. These are superior relations. Inferior. This is anterior. This is posterior, right? Deltoid is always posterior. So, what are the anterior relations? Anteriorly, what can you see? One, anteriorly, you can see subscapularis muscle, pectoralis major muscle, right? Subscapular, this is subscapular bursa. This is subscapular bursa, if you can see, right? And you can see coracobrachialis, short head of biceps, right? And even deltoid muscle. So this part is the anterior muscle, anterior relation. And coming to posterior relation is this part. If you see, it is infraspinatus, teres major, teres minor, and deltoid. What are the superior relations? They are acromial arch, subacromial bursa, supraspinatus muscle, deltoid muscle. What are the inferior relations? Inferior are long head of triceps, axillary artery, axillary vein, axillary nerve, and even posterior circumflex humeral vessels and talus major. So these are the relations of the shoulder joint. So in our next class, I'll again write these relations in a table form again, and then we discuss about the bursae and arterial and nerve supply and factors providing stability and then movements around the shoulder joint in our next class. Okay then, bye.